All right. Well, wake up, pre-health sharks. Welcome to our weekly webinar segment called Wake Up Pre-Health Sharks. So wake up. And today we're going to be talking about a lot of different topics within healthcare, pre-health. And that's what this segment's all about, to assist you as science students, pre-health students, to reach your career goals in healthcare. So we have expert panelists, expert advice to give out. And so I'm going to introduce myself. My name is Emilio Lorenzo. I'm the Associate Director of Employee Relations for the Career Development Office. And I'm going to let our other consultants on this webinar introduce themselves.
Hi, everyone. My name is Gabby Gross, and I am an Excel Career Advisor within the Office of Career Development.
And hello, I'm Danny. I also go by Danny the Machine. I don't, but I am also an Excel Career Advisor in our Career Development Office.
So this is a weekly segment, as I mentioned. It's geared towards pre-health students. All three of us are experts in assisting you, whether you're going to graduate school, you're looking for research opportunities, you're thinking about shadowing, and how to navigate all the aspects that come with being a pre-health student or entering healthcare. So today's segment, we're actually going to be covering the 5 pillars of pre-health. And you're probably wondering, well, what are 5 pillars? And these are basically areas that are going to make you successful, whether you're graduating and going to medical school, dental school, or any other healthcare profession. So all of our experts, we're going to dive into each segment within the pillars. We're going to talk about it. We're going to give you resources that you could be using. And then we're going to talk about why each one is so important in your application. Because just like a house or a building, each pillar is important. If one pillar falls down, the whole house goes down. And so we're going to be talking about each pillar, giving you advice. And then at the end, we're going to go do a little round robin and give you some tips and tricks to kind of go forward. So to start off with, the 5 pillars are really essential areas that are going to make you a successful candidate for whatever professional or healthcare program you're going into. So we're going to talk about academics. We're going to talk about healthcare experience. We're going to talk about research, leadership and professional experiences, community involvement. At the end, we're going to talk about that wow factor that is really important in your application. So let's jump on into it. And I'm going to turn it over to one of our experts to start off with our first pillar.
Awesome. Thank you, Emilio. So the first pillar that Emilio brought up was academics. And academics really is the priority to be a competitive applicant. That is what you should be focusing on during your time in undergrad. You are a student for a reason. So, your studies should always come first. Setting up really a competitive GPA for yourself is very important. So really utilizing like academic advising to help you set up those specific courses that you need, as well as tutoring and testing. They have so many different resources for students to just really dive deep into study sessions, SI sessions, tutoring sessions, and the list really goes on with their resources. And then, like I said, academic advising to not only really help you set up your academic plan, but really put you in those right courses. So those prerequisite courses that you need to focus on, because to get into any pre-health program, there are certain classes that you need to take. So you want to ensure that you are taking those correct courses. In addition to that, under academics really also falls those entrance exams, So things like the MCAT, the DAT, whatever program that you are applying to, you're going to want to focus on making sure that you have all of the right information about these entrance exams and making sure you are studying for them as early on as possible and really intertwining, working on that within your studies as well. And then just to wrap it all up, just educating yourself on the application process. So making sure you're aware of everything that you need to really get into these programs. And lastly, just to remember that really numbers come first. I heard that, I remember from an admissions counselor a couple months back, and it's so true that really these programs are more looking at your numbers than anything else.
Yeah. And don't get discouraged. I mean, Gabby mentioned a lot of great points, but you're not going to be defined by that one organic chemistry class that you didn't do so well in. What you're going to be defined in is how you recovered from that. All the time, healthcare programs ask you, hey, can you tell about a time you struggled and how you reacted to that? And so if you did not do well so much in a class, what did you learn from that helped you improve for the next class? That maybe, you got a B+ in organic chemistry too, but maybe you didn't do so well in Org 1. I think it's important to be able to identify those things and how you're struggling and how you're recovering from it. Because it's going to be important in that interview to talk about those academics, because sometimes it's hard to have a perfect record. But in healthcare, and when you enter a healthcare program, guess what? That first 2 years you're working with patients, you're going to hit the dirt. You're going to get a little bit struggle, or you're going to face adversity. And you're not going to be defined by that one patient, or that first time you do an extraction and you panic or you're not doing so well. You're going to be defined on how you learn from those experiences. That's why those medical school applications or healthcare applications, they always allow you to explain why a grade happened that way. And you also have your personal statement to explain with things that we're going to be talking about in other segments. But I want to mention, because what Gabby said is right, the numbers do matter, but there's also ways to be able to explain yourself. Also, Gabby mentioned about professional tests, you know, MCAT, DAT, PCAT, all of those. I think it's important that throughout your academic journey, you schedule those exams early on so you could identify your weak points and you could be able to take that exam again. Usually going into your junior year is a great time to take it for the first time, but don't rush yourself. If you don't feel you're ready, there's a lot of other resources, tutoring and testing, as Guy mentioned, that could really assist you with those type of things. So academics, one pillar down, now moving on to our second pillar.
Yes, so I'll be going now into our healthcare experiences, which, as you can imagine, is a huge pillar when it comes to you being a pre-health shark. So with going into healthcare, you want to be able to confirm that this is the right field for you in the first place. So one thing that we typically advise students to do, especially during more normal times, is to be able to outreach and shadow different physicians or healthcare professionals to really get a feel of the field and see what kind of specialty maybe you would like to go into in the future. So one way to do this is either first leverage the personal connections that you already have, maybe the physician that you already see, like a family doctor, NSU alumni that are always open to really working with our students and helping them build that connectivity into the future that you'd like to go towards, or even just doing some outreach to people that you find who are physicians or healthcare professionals, even on LinkedIn. So sometimes it helps to either do some informational interviews and reach out to them, maybe ask some questions about what their day-to-day is like, some strengths they feel like you would need to build in order to become a healthcare professional. And if you're able to find a way to shadow that professional and really see face-to-face what it's like to interact with those patients, to see some of those procedures, that would be excellent. And with recent circumstances going on right now, even finding ways to do some telehealth or opportunities to find ways to either video call in or phone call in to see if you can really still build that experience right now over the summer. There's opportunities to still do things remotely, like telescribing or becoming just a scribe yourself. There's different companies that we as NSU's Career Development Office have some good relationships with, like Scribe America, PhysAssist, and we often have them come in for info sessions on our campus. So it's something great to do something like scribing, because you gain a lot of experience shadowing these professionals while gaining a lot of that medical terminology that could be a good piece to your vocabulary later going into healthcare. Some other interesting opportunities to gain that healthcare experience could be some medical internships at places like Cleveland Clinic. They invite a lot of our pre-health students to come in over the summer, and it's really immersive for our undergrad students. Or something like at FIU, they have a Doctors of Tomorrow program where it's about a week-long program for students interested in med school to get to meet some of the admissions office, the team who would be teaching you in med school, and really gaining an opportunity to meet some of the students in med school now and understand what you would be going into in that kind of program. So there's lots of different ways to gain those healthcare experiences, and it's really important, especially while you're in undergrad, to see if you can gain these experiences, gaining face-to-face focuses with patients or meeting physicians and getting to understand what the field really entails.
Danny mentioned a lot of great points about this pillar. And I think it's important to know that healthcare experiences come in a lot of different forms. Danny was able to talk about shadowing, was able to talk about scribing, traditional opportunities and internships. There's so many hospitals, medical centers, facilities down here in South Florida. Every one of them has a volunteer program, and majority of them have some sort of a shadowing program. But you got to be willing to put yourself out there. You got to be willing to make a connection, pick up the phone call, talk to people. But when we started the discussion on this pillar, Danny talked about leveraging your own network. Everyone has their own family doctor or someone that they know that is a doctor. Start there. You never know who that person knows or if they're willing to provide you a shadowing opportunity, but it's a great way of getting your foot in the door. And while you're in undergrad, it's really difficult to get clinical exposure. What you're trying to learn is that medical terminology, as Danny mentioned. It's important to be able to put yourself in settings that you get stressed out. The first time you volunteer in an emergency room, you're going to feel like, what is happening? This is a lot. But you learn that skill, you learn that adaptability, something that could transfer over easily into a traditional healthcare setting when you start working in the field. But there's a lot of different options. Career development every month says different opportunities out through our newsletter. And we definitely have a lot of relationships, including Dan mentioned Scribe America, that can really assist you within this pillar. But obviously you want apples to apples experience in this. And so there's a lot of avenues where you could be able to gain that, something that our career advisors can help coach you on as well.
I was going to add in, Emilio, also really the importance that this pillar helps you to confirm your passion. Like there's no other way to confirm the passion that students have for medicine unless they're really diving in deep to doing shadowing, doing professional programs, and etc.
Boom. Honestly, Gabby, that was such a great point. You know, that's a wake up moment in our segment here. That's a key element. You know that every healthcare program, whether it's medical, dental, pharmacy, what have you, the first question after tell me about yourself and why are you interested is how did you confirm it? Why you're interested is much different than how did you confirm this passion. And it can't just be, well, I read about being a doctor in Time magazine. That's not enough. Tell us specifically tangibles. What did you shadow? What did you learn from those shadowing? And a strong answer is not, well, my parents were doctors or my parents were in healthcare. That could be an aspect of it, but what did that lead you in? Did that make you shadow them? Did that help you see more specifically what healthcare provides? Give them the aha moments. We're going to talk a lot about those wow factors, but we're also going to talk about the aha moments. And some experiences like this really give you those aha moments. But what Gabby mentioned is completely true. These are the experiences that help you confirm what you want to do. Whether you got paid or unpaid, that doesn't matter. Whether you went on a medical mission trip, whether you shadowed, whether you did a traditional internship. And just one last thing to mention, Danny had talked about those summer immersion programs. Those exist all around the country. They're like SMDP programs, summer immersion programs. They are really important. Sometimes you even get to work with cadavers. You get to work with dummies. You get to really practice a lot of these skills. In fact, this past year, NSU and our office, we hosted a lot of clinical workshops with U.S. Army medics that taught you how to do respiratory management, how to do triaging, how to do bleed management. And you actually got to work on dummies and other students that were learning these skills. Those are really hands-on things that could be sold or told within an interview in medical school or any other professional program. So a lot of great nuggets of knowledge going on so far. Let's jump into our third pillar. And I think I'm up right now. Research. You know, with this pillar, a lot of students say, well, I don't really want to do research because I don't want to be a researcher. I just want to work in healthcare. The truth of the matter is, no matter what area of healthcare you're going into and your long-term goals in it, even if you don't want to ever publish a paper in research, every one of you going into a healthcare career has to immerse yourself in research. Because think about it, even if you're not a research assistant, let's say you graduate and you're working as a dentist or a doctor in your industry, guess what? You're going to have to go to conferences. You're going to have to go to lunch and learns, workshops. You're going to have other professionals in the field in pharmacy or other do presentations to you because the field of healthcare is ever changing. And if you're not a professional that is immersing yourself in the knowledge, it's going to pass you right by. And patients and other healthcare professionals are going to notice that. It's going to hurt you in the long run. So you need to get in the habit of immersing yourself in the knowledge. Also, we just did a whole segment on the pillar for healthcare experiences. The truth of the matter is there's not a lot of experiences in healthcare that you're actually doing the clinical skills because there's not a lot of patients that want undergraduate students actually performing procedures on them. So the way to gain the most knowledge in healthcare or immersing yourself is through research. And it's great to start small. Do experiences with your faculty members. Your first experience doesn't have to be in the exact area of research that you're passionate about. Maybe you want to work in cancer research, but your first experience might be in a completely different area. But by doing that, you're building up your experience in research so that you can apply to the more lucrative research opportunities. So network with your faculty. Students ask us all the time, hey, what research opportunities are available on campus? You want to make sure that all of the research opportunities, you talk to your faculty members before anything else. So when you go and talk to your faculty during office hours, talk to them about, hey, what research opportunities are there available? What are strategies I can do as a student to be able to gain more research experiences? Have these informational interviews. We're going to do a whole segment in one of our future webinars on informational interviews, but your first stop should really be with your own faculty, ones that you've had classes. And if they don't have a research opportunity, they might know another faculty member that does have that, that may have that opportunity available.
Yeah, and Emilio, I wanted to add also that these students can't underestimate the value of building these relationships with these faculty members, because not only will they, of course, be gaining the research experience, but first of all, it's going to be possibly an excellent letter of recommendation they'll be getting for these pre-professional programs in schools, and the connections that usually faculty members and professors have either in the health field or with other faculty members can be pretty invaluable to the students too.
Absolutely. A great knowledge nugget right there. These letters of recommendation, you got to be building up every year. And so not that you need to ask them year 1 or 2, but if you've only had a class with one professor and you did great in that class, but now you're asking a letter 3 years later, sometimes it can be difficult. And that's why going to those office hours, doing research experience with them, not only gives you someone else that you can ask a letter to, but the letter is going to be even stronger, because not only do they know your academic abilities, but they've seen you immerse yourself, the passion you have for the field, and being able to use those research topics within a relevant, healthcare knowledge area. There's also national research opportunities. They're called REUs, or there's the SURF program, or there's opportunities at Scripps Research Institute. There's a whole database. If you go to the National Science Foundation homepage, there's a whole list of over 700, over 1,000 research opportunities nationwide. The great thing about these opportunities is they provide stipends, they provide housing, they provide everything you need. And they're immersive research opportunities on relevant topics. Great selling points for your resume, for your applications. Again, doing these experiences might help you apply to a more lucrative research opportunity down the road. Now, these are very competitive programs, but that's why you have amazing career advisors like our 2 experts on the webinar here that can really assist you in applying to these strategically. You should always apply for more than one. Like I mentioned, they're very competitive. And so the first time you look at the list of all these opportunities, you should almost go window shopping and identify out of these 1,000, which are in areas I'm actually interested in. Pick your top 10 and then work strategically on identifying what are the requirements, what are they looking for, how do I put my foot in the door, or how do I apply strategically, all things that we can help you with. But those national research opportunities have a lot of benefits. And again, it's also great networking opportunities. You might find an REU at a medical school that you are really interested in, and you might be working with faculty that are the ones that might be reviewing your application. So all of it is very important. And honestly, today, there isn't a medical school or a healthcare program that isn't looking to see if you have research experience. So again, it's okay if it's not one of your passion areas, but just know it's one of the main factors that these organizations, these grad programs are really evaluating for it. So that's some strategies to get it. The other is our office hosts 1 to 2 pre-health competitions every semester. And so these competitions really challenge you to use your research skills on a relevant topic. So we did one this semester talking about emergency situations, PTSD. We did one on nutrition. We've done one on vaccines and the measles vaccinations. All of these case competitions have a presentation component, but leading into that presentation, you're doing a lot of research on the field and then using your critical thinking skills, which is one of the main skill sets, non-healthcare, that they're really looking for. So these competitions really have you use that skill set. And then you have a way to sell that strength within that professional interview when you do apply to graduate school. So case competitions, national opportunities, talking to your faculty for on-campus roles, or looking at other experiences, even in our HPD college that we post, they have awesome opportunities to really get your foot in the door in the research. But you got to put yourself out there. So remember to outreach, outreach, outreach. You don't know what you don't know. And so don't be afraid to reach out to these life science companies. Don't be afraid to go to a networking event. This past year, we even hosted a few weeks ago a whole life science conference that had over 12 to 15 life science companies in South Florida that were eager to hire our students for research opportunities. So yeah, leverage your network, look at national opportunities, but you can't just be clicking and applying. You got to put yourself out there and network and outreach to these organizations.
I was going to add in, Emilio, about the outreaching piece. That's so important. Actually, if a student is feeling like maybe their faculty aren't reaching back out, or they're not able to connect them with other faculty members, on the NSU undergraduate research website, there's actually an NSU expert database that I show a lot of my students that they can use to just really type in their research interest into the search bar and see what faculty at NSU are doing research in that area or in similar areas, so that they can outreach to those faculty. So that's another way for students to do some more searching on how they can connect with faculty.
And that's a great point. And maybe even going into that meeting with that faculty, you can read an article or two of what they've done, so that when you're inquiring, oh, I'm passionate about your area of research, and they're like, oh, really? What do you know about it? You're not like, well, I just read the title. So I think that what Gabby mentioned is another great resource to assist you.
Definitely.
All right, so moving on along, we're kind of in our second to last pillar. We are now at leadership and professional experience. So I'll turn it over to one of our experts to dive deep into this.
Awesome. Thank you, Emilio. So I would say this is actually my favorite pillar because it's the more like unexpected pillar, and it's actually two parts. So I'm going to first just discuss the leadership portion, and then I'll go into professional experience as well. Both of these areas are really important just to develop transferable skills. That's what I want really everyone who's listening in to remember, is that developing those transferable skills is very important, and you wouldn't think it to be in different areas, but a lot of these professional programs are really looking for that. So let's just talk about leadership to begin. Leadership in any area is important, especially really more on-campus or off-campus opportunities. So with on-campus opportunities, you can do really, there's a boatload of different experiences, such as being a shark preview leader, maybe being a leader in a club. Let's say you're the president of Pre-Med Society, or the president of MedLife, or you're the secretary. It really doesn't matter what leadership position you're in. Maybe you think about doing an orientation leader position or becoming a peer leader. Really, leadership is in all of these names, so it makes sense that you would be a leader in these positions. And then just thinking also about doing professional experiences in general. It doesn't matter if it's not linked directly to healthcare. I know Danny dove deep, into, those healthcare experiences, but doing any sort of professional experience is important. So I always tell my students, let's say it's working as a summer camp counselor, or working at an ice cream shop, or working at a store. You're really just developing those skills needed, such as, time management, communication skills. This list of skills kind of just goes on and on that you would need in a healthcare type of role. So again, leveraging those personal and professional connections, like we've been saying in every single pillar, is important to finding these kind of opportunities, whether they're leadership positions or just professional experiences in general. And something I also want to add is really just thinking that summer is a very important time also to gain these experiences. I know during the school year it might be tough to do something like, a job or a leadership experience, but the summer is also a great time to dive deep into these experiences as well.
Absolutely. And Gabby, just to build off what you said, you should all ask yourself, if you're a pre-health student, what are the qualities, the skills, and all the intangibles that make up a successful healthcare professional in the area you're trying to get into? So ask yourself, what makes a successful doctor? What do you love about your doctor, your PT, your OT, name it? chances are the first thing you're going to say is not their clinical abilities. You're going to talk about their communication skills. You're going to talk about their bedside manner, their ability to do complex information and putting it in understandable terms, their ability to build relationships, problem solve, adaptability, all these other characteristics. Guess what? You can develop those in a lot of these experiences that Gabby mentioned. I mentioned in one of our earlier pillars, it's hard to find apples to apples internships in healthcare sometimes. And healthcare programs aren't expecting you to come in and know how to do a root canal, not expecting you to come in and know how to do a procedure. But what they do expect is that you have the soft skills, communication, relationship building onwards, that can be applied to a medical setting. For example, and I always use this example, I had a young lady applying to medical school, and she was talking about, you know, I don't have a lot of experiences that I feel can apply to medical school. And then I asked her, what did she do in the summers? And she had worked in the summers working for an AC company in South Florida. And she handled the phones there. But nobody's calling an AC company in the summer and saying, hey, guess what? The AC's working great. You guys are doing a great job. So all day, she would have constant phone calls of people upset, complaining, you know, wanting their AC fixed. In healthcare, you're going to deal with a ton of patients that are upset, and they're not upset at you. They're upset at the situation. But guess what? You have to be able to diffuse that. You have to be able to use your active listening skills to be able to meet their needs. You have to be able to calm them down and really make them feel connected that you are on their corner. You're trying to help them out. So an experience in a non-healthcare setting can really be a good sell point for when you're applying to an actual healthcare program or a healthcare opportunity.
Yeah, definitely.
One thing I wanted to add too was a way to double dip and kind of both with professional and healthcare would be even working as a front desk receptionist at one of your local clinics or at a somewhere nearby in a healthcare setting. So not necessarily you shadowing a professional who's a physician, but you could be that front facing person who, you know, checks in the patient, kind of calms them down and makes it feel like it's a welcoming environment. Because those are some of those interpersonal skills that are really invaluable when you're applying to these programs.
Exactly. And you should also take a look at nonprofits. You know, when they ask you, why did you want to get into healthcare? You're going to say, I'm so passionate about helping the world, making an impact. What specific examples do you have to do that you did that? Because if you say, I want to help others, you don't have to always look for an opportunity that you're doing healthcare skills. You can work for a nonprofit like Debbie's Dream Foundation that helps to cure stomach cancer. You can work with a lot of nonprofits that are eager to have volunteers and have you help out. And that's tangible ways of saying, hey, don't just take my word for it that I want to make a difference. Here's where I'm doing it. And there's a lot of different organizations that can help you live out that mission and get that exposure. But it's important to think about that soft skill. It's also about thinking of the exposure to certain patient populations. You know, working with the Special Olympics, working with different organizations can help you work with different unique patients or unique populations that can be valuable when you get into these healthcare programs.
Definitely.
All right, moving it along. I think we're on our last pillar. Last but not least, our community involvement.
Yes, and we had the perfect transition with you talking about the impact these pre-health students would want to make on the world. And I know most of the pre-health students I've worked with in the past, of course, their passion is to help and work with patients to make them feel like they're living their best lives. And one way to do this is showing these med schools that you are involved in the community kind of in a multitude of ways. And we're lucky that, you know, in South Florida, there's a lot of different options like Debbie's Foundation that Amelia was talking about, these different nonprofits that you can find. And even volunteering at hospitals and hospices can be a fantastic opportunity to be in that healthcare setting as well. So it may be a little bit tricky with recent circumstances to be volunteering directly at a hospital, but there have been some creative opportunities for students to still find ways to help out the local healthcare facilities. So one creative way would be even in contributing by making some volunteering to create masks and send them to the hospitals. I know there have been some fabric stores like Joann's Fabrics in Plantation right next to Nova that does provide some free kits for students if they want some fabric and tools to make those masks themselves, or even volunteering to call up some of those elderly care facilities and hospice care places to be one of those calming figures that talks to these patients and make them feel like they have that connection with someone. So those are small ways to still be volunteering in a healthcare type of setting. There's also ways to do, like Emilio had mentioned earlier, these medical mission trips like MedLife, or even in our student leadership and civic engagement office, SLICE, as you may know, they do these weekly SAS trips across throughout the year that they could take you across the country, or sometimes even to a different country entirely. And you'll be dedicating yourself to one full community service mission. And that's a great way to not only build relationships with students on that trip, but be really making an impact on that community and being able to talk about that in your application. There's different ways for you to get involved, even just in the local Broward community. So getting involved with Hands on Broward, if you're wanting to do even beach cleanups or food drives, Special Olympics, any way that you can find yourself immersed into the community and showing you have a deep impact to want to help people, that's going to be fantastic for you to build those experiences.
And Memorial Health System, which is a lot of the opportunities down here in South Florida for the hospitals, they're doing that same thing with the mask kits and something students can get involved in. But yeah, Dan, you mentioned a lot of great points. Make a difference. You want to impact the world, you got to do community involvement. It's easy when you're doing an internship and you're getting paid for it, or research and getting paid for it. It shows a lot when you're making a difference and sacrificing weeks, sacrificing spring breaks, putting yourself out there and doing these things that you're making an impact. But the only thing you're gaining out of it is that satisfaction of making that impact. And so I think those things tell a lot in your application. And so it's a way of showing that you're passionate, and just instead of just saying or telling them that you're passionate about it.
That's right.
So a lot of great information on all of our pillars. And so I hope that this was able to give you insights on why each pillar was so important. How do you get resources in each pillar, and how can it assist you, and why it's so important in the application? Now, something that isn't part of the pillars, but is still very important in your application and your kind of track towards a healthcare program, is your wow factor. How do you stand out amongst other applicants? And there's a lot of ways of doing that. And I think one of the big things is not cutting yourself short. I think humility is very important, but when you're applying, you want to make sure you're talking about all your experience. You want to make sure you're talking about the impact that you're making. The wow factor is something that you should be thinking about your whole 4 years, because a lot of doors get presented to you throughout your 4 years at NSU and college. We talked about SAS trips. Obviously, it's sometimes difficult to give up your spring break or time off to go on these SAS trips, but look how valuable these experiences are. The stories that you get from it, the impact that you're making on the lives of others. Those are the type of stories that in your personal statement and in your interview are going to stand out. It's something that you can't just bring up or can't get from something else. One thing is spending an afternoon in a homeless shelter, which is still very valuable, but it's another thing that you're going on a medical mission trip to Chile. And so I think these are experiences that give you that wow factor, that you're going to be able to storytell. I'm a big fan of storytelling in interviews and in personal statements. It's the things that make it eye-popping and make it stand out. And the way you get these rich stories is by putting yourself out there, opening doors, getting out of your comfort zone, and doing non-traditional ways of really getting exposure and making a difference. It's these wow factors that make that admissions committee being like, wow, this person did a lot or made an impact. And wow factors can come in a lot of different forms. Doesn't always have to be these trips, but putting yourself out there and finding something that you could sell back and really showcase as, wow, I did something different, or I went outside my comfort zone to make that difference.
Definitely, Amelia. I think you bring up so many great points. And what I really want students, who are thinking about all of this to realize is that most students have all of these, areas, these pillars. They're focusing on all of these things. So really, what is it that helps you to stand out? You're going to be competing with students from all across the country, all across the world for these spots in these professional programs. So, just bringing up an example, there's a big difference between being a president of an organization or even starting that organization yourself. So, you have to think about what sets you out, what makes you unique versus all of the other students across the world that are really applying to all these professional programs.
Absolutely.
Yeah, even in my own experience, sometimes working with students developing their personal statements, applying and trying to figure out that wow factor, sometimes it's even your own personal experiences you've had throughout childhood or high school that really sets you apart too. It's like I've had multiple athletes who want to go and become physical therapists and have talked about their own experience rehabilitating and realizing the impact their own PTs have had on them. And that itself can be a bit of a wow factor, because you're showing them you've shadowed in a sense by being there in that setting and experiencing that support before.
And we all have our own individual story. The wow factor doesn't need to be the next motion picture, the next Quentin Tarantino film. What it needs to be is something that stands out for you, something that showcases and brings to life all these passions, all these things that make you such a great candidate. And there's a lot of ways, as we talked about, whether it's within clubs, trips, external positions, or just even in current roles where you went above and beyond, and there's a specific story for that. The way we impact lives can come in different forms. What we're talking about is make sure you're putting that out there, because there's going to be other applicants that are really going to be focusing on that. And that's what makes you stand out within the pool itself.
Mm-hmm.
Definitely.
So, guys, we've talked a lot today. We talked about the 5 pillars. We talked about your wow factors. You know, we've been able to hear from all 3 of us, all of our expertise. So if you want more guidance on your applications, you want more guidance on finding some of these experiences that we talked about, the Career Development Office is here to help you out. We post opportunities on Handshake. Our advisors can coach you, and our employer relations team can put referrals for you. But it starts with getting someone that is in your corner that can have that one-on-one coaching with you. And so don't forget to make an appointment with our office. You can do it right there. You can see the instructions on the slide here, where you can go on a Handshake or go on our website, and it has a link right there on how to schedule an appointment online. Or you can call our front desk at 954-262-7201. All of our advisors, all of our team are cross-trained. They're experts in this knowledge. And it's better that getting into a healthcare program or reaching your career goals can sometimes feel like climbing a mountain. Why not have someone in there that's climbing that mountain with you and giving you guidance and calling you out when you need to get called out on areas or pillars that need work? As we talked about, every pillar is important. So after this webinar, or after listening to this or working with your advisor, take some time to evaluate where you stand on each pillar, because there's plenty of times to be able to build up a pillar. And you just want to identify what are my strengths and what are my weaknesses on all the pillars we discussed. So a lot of great information from our experts. And this was our first weekly segment. So I hope you were able to wake up with some great information. But our Wake Up Pre-Health Sharks is going to be a weekly segment. And you're going to be able to see us tackle a lot of different topics. And if it's a topic of interest, don't hesitate to be able to reach out to us at our career office at career@nova.edu, as we'd be happy to be able to tackle some of the subjects that are important to you. So we're here to support you, our Sharks, and give you an edge in your pre-health career. And we hope to see you next time. And we hope to wake you up with some great pre-health news.